Hi everyone, my name is Anita Asimedu. Today's presentation will explore cholera, a deadly but preventable disease that continues to impact millions globally. We will look at the historical significance and how it spreads and affects populations today and what the global response looks like. By understanding its epidemiology and burden, we can better appreciate the importance of prevention, timely treatments, and coordinated public health efforts. Cholera is a serious intestinal illness caused by Vibrio cholerae, usually from contaminated water or food. It leads to rapid fluid through diarrhea, which can be fatal without prompt treatment. Its spreads often reflect poor access to clean water and sanitation, especially in crisis affected or low income regions like third world countries. This makes cholera a marker of health inequity. Preventing cholera depends on clean water, improved sanitation, hygiene, and vaccinations, especially vaccinations. In high vaccinations in high risk areas, according to the World Health Organization. The World Health Organization tells us the history of cholera that includes several major pandemics, starting with the first in 1817, which spread from Ganga Delta. The seventh and ongoing pandemic began in 1961 and has persisted, especially in vulnerable regions. Each of these global waves not only cause widespread illnesses and death, but also reveal serious weaknesses in public health infrastructures, particularly in areas lacking clean water and sanitation. In the epidemiology, we want to emphasize on how cholera remains a persistent public health challenge, especially in regions where it's endemic with over 47 countries globally. The heaviest burden we see is seen in parts of Africa, South Asia, and the Middle East. Outbreaks are more likely during rainy seasons and humanitarian emergencies when water systems are disrupted. In 2024 alone, over 800,000 cases were reported across 33 countries, underscoring the urgent need for prevention and response strategies. So we see the bar chart in this slide, and we know the annual estimate of cholera causes between 1.3 and 4 million infections worldwide each year, with fatalities ranging from 21,000 to 143,000. In 2024 alone, we saw more cases and death than we saw in 2023, just a year interval. We see that the Eastern Mediterranean and African regions continue to experience the highest disease burdens. With a rise like this, we need to ensure access to clean water and sanitation. We see who the World Health Organization developed strategies for emergency vaccination campaigns by developing oral cholera vaccines. They also strengthen surveillance and reports by creating mobile units in remote or hard hit areas, targeting interventions and work to educate the public on boiling or treating water before drinking, consuming well prepared food, and promotes hygiene such as washing hands with soap before and after eating. The World Health Organization and the GTFCC launched a global roadmap to reduce cholera deaths by 90% by 2030. The strategy is built on three pillars: early detection, targeted prevention, and coordinated response. It focuses on cholera's hotspots, improving wash systems, and strengthening community education. Education is crucial in things like this. This slide emphasizes a kid that is being vaccinated. Note that the World Health Organization Strategic Accessory Groups of Experts, SAGE, conduct a comprehensive review of the oral vaccination usage during this period. Also, who confirms that the oral vaccinations are safe and effective and officially endorsed for public health use. One must note that in every health situation, an emergency preparedness program must be set in place. This is why the International Coordinating Group (ICG) manages a global stockpile of the oral vaccination for rapid deployment in response to urgent cholera treatments. The World Health Organization emergency use listing helps speed up vaccine access during um, outbreaks by ensuring cholera vaccines are safe, effective, and ready for use, especially in countries with limited regulatory systems. Cholera caused by Vibrio cholerae, mainly um, serogroups 01 and 0139. It spread through contaminated food or water. As noted, key variant factors include cholera toxin, and TCP diagnosis relies on stool culture or RDTs. Prevention includes clean water, as already noted, sanitation, and the oral vaccination. Treatment involves rehydration and antibiotics. The disease, as we know, is endemic in over 47 countries and is deadly without prompt care. The World Health Organization states that 2011 WHA 64.15 resolution pushed for global action on cholera. In 2018, WHA 71.4 endorsed the GTFCC's plan emphasizing clean water, wash, disease tracking, and access to oral vaccines. These efforts rely on international cooperation and supports. We want to conclude by emphasizing that cholera continues to take lives, yet it is entirely preventable. Long-term investment in clean water, sanitation, and health system is essential. With strong global partnership, vaccinations, and quick response to outbreaks, we can reduce its impacts. Reaching the 2030 goals will require ongoing dedication from all sectors. Thank you. This is the end of my presentation, and I wish you all the best.